Occasionally, baby can become very unhappy with the contractions during labour, to the point that we need to get baby out with severe urgency. That means that the methods that I've described previously, so an epidural top-up or a spinal anaesthetic, would not be able to numb you quick enough for you to be operated on awake and baby to have a good outcome. In this instance, it's incredibly rare, but we give you what's called a general anaesthetic, which is where we drift you off to sleep, keep you asleep for the operation, and then wake you up afterwards. Unfortunately, due to the nature of the emergency situation, there's lots of people talking at once. We will try and keep the noise to a minimum, and the people that are around are only those that need to be there. For a general anaesthetic, unfortunately, your partner won't be allowed to be in the room for you. But don't worry, as soon as baby is out, we will let them know. Everyone has a job to do, and they will look after you. We get everything totally ready to go from a surgical perspective before we start the anaesthetic itself. This means that we minimise the amount of drugs that get transmitted to baby before the umbilical cord is clamped. This means that they'll put a little plastic tube into your bladder if you haven't got one already, just to make sure the bladder is drained. We will put some drapes up, and the surgeons will paint your tummy with some cleaning fluid to make sure that your tummy is all ready to go from an operative perspective. Don't worry, they won't be allowed to start operating until we give them permission to do so. Just before you go to sleep, we give you an anti-acid drink, as lots of people get reflux during pregnancy. It's shown in this little bottle here. Unfortunately, it doesn't taste particularly nice, so drinking it quickly is preferable, but it's a very good anti-acid. And it minimises any problems as you go off to sleep. Just before you go off to sleep, we will give you lots of oxygen to breathe through a face mask. This just washes out all the air in your lungs and replaces it with lovely pure oxygen. You can hold the mask if you wish, just ask your anaesthetist and they will let you do so, but you do need to keep the mask very tightly on your face to make sure all the oxygen goes into your lungs. Once we are happy with everything, we will begin the anaesthetic and let you know we're drifting you to sleep. The anaesthetic medication is quite cold as it goes up your arm. It can make you ache a little bit. That's normal, it's nothing to worry about. You just keep taking lovely steady breaths and thinking of your baby, and we'll take very good care of you. Just as you drift off to sleep, our anaesthetic assistant puts a tiny bit of pressure on the front of your neck, just to minimise the amount of acid that comes up as you go off to sleep. The vast majority of patients have no memory of this at all, but we warn you because we don't want you to think we're strangling you, because that's definitely not our intentions. And don't worry, we won't let the surgeon start until we're very happy that you are safely asleep. We keep you asleep for the operation until baby's out and all the wound is repaired. We will give you painkillers and anti-sickness medication while you're asleep, and then wake you up when it's all finished. At the end of the operation, you may remember us saying, open your eyes, stick out your tongue or squeeze your hands, just as you're waking up. We then will take you to the recovery ward, where the nurses will look after you for around half an hour to an hour, and they will be able to fix any problems such as pain or sickness afterwards if this is appropriate. But hopefully the painkillers and anti-sickness we've given you while you're asleep is good enough to prevent that. With a general anaesthetic, you sometimes get a sore throat for a couple of days afterwards. It doesn't last longer than it goes away. There's a small risk of damaging either the lips or the teeth by putting the breathing tube in, but it's not common. As we've said previously, all of the medications we give you are safe for baby and safe for breastfeeding. And the previous explanation with regards to taking the painkillers regularly is very important, particularly as general anaesthetic C-sections can actually be more painful than an anaesthetic which is done while you're awake.